Hi everybody. This screencast is going to take you through how you access Sheffield City Council ward profiles. As part of your assessment, you are required to source an area of Sheffield that you will link to your assessment. So these are known as wards. So what I want you to do is go onto Google and type in Sheffield City Council ward profiles, and up will come ward profiles for Sheffield City Council. If you click onto this will take you through to what they call their ward profiles. And if you scroll down, just close the adverts. If you scroll down, you will see areas of Sheffield that some of you might be familiar with, or some of you won't know what they mean or where they're from. Okay, and it's down to you to look through these ward profiles so that it matches your target group that you will select for your assessment. Okay, and what I'm going to do now is just take you through some of these just to show you the types of information that you can source that you will need to use to embed within your assessment. Okay, so for example, if you are looking, we're just going to take you through some of these. So we're going to click on the Burngreave ward profile for starters. And in here, as you can see, it was last updated October 2017. This is probably because it's linked to the general census that is undertaken by the country at the time. So 3 years out of date, some of these figures, but don't worry about that. So the Burngreave ward here, as you can see, this is where it is highlighted within the map of Sheffield. So the northeast area of the city, so quite close to the city centre as well. If you keep scrolling down, it gives you quite a lot of information and statistics. So it talks to you about the population of the ward, okay? And this is from the Office of National Statistics, so something that you would be able to reference within your assessment. It also talks to you about the neighbourhoods that are within the ward. So within the ward of Burngreave, the areas and the neighbourhoods are Abbeyfield, Burngreave, Furze Hill, Firth Park, Fir Vale, Langsett, Longley, Shirecliffe, Woodside. Okay, so the asterisk there, as mentioned, is that only a very small area of that neighbourhood falls within the boundary of this ward. So think about maybe where you're from and what those wards are and who's located within them from wherever you're from geographically. Carrying on scrolling down, this is the latest census. This is what it tells us about the Burngreave ward. So it will give you a breakdown of gender within that. So as you can see, there's a slightly higher percentage of males that live here as opposed to females. Okay, and it then breaks down your age group. Okay, so this is where you need to start thinking about and being specific with regards to your assessment. So you might be thinking about your target group population of being older adults. Okay, and this is where you can absolutely find the actual information to link to your target group. So within your assessment, we'd be expecting you to tell us the percentage of people that live in that ward or that area. So you quite clearly here it says 11.4% of the population of that ward are over 65. Okay, and then you might be more specific and go, I'm relating this to females within older adults as well, and you can tell us that breakdown of the population as well. So some really, really useful information here. Information around religion and beliefs. Okay, there might be something that, we've spoken about the barriers to why target groups don't access sport and physical activity. And, there might be something around religion beliefs. So potentially when some of these religious groups maybe go to church or maybe have prayers at mosque, is that going to impact your program of work that you're looking to develop as well? It breaks it down further in terms of the ethnicity breakup of the area. Okay, so this area of Burngreave, this ward area, has a high population of BME target groups as well. So again, you might be looking to develop your program work around that target group as well. So you've got some real evidence here that you can use to underpin within your assessment as well. It then goes on to tell you about the number of people that live within households. So again, if you were looking at older adults, for example, you would see that 966 people are living alone. So maybe what does that mean for them in terms of isolation, loneliness, maybe anything to do with social behaviour. Okay, so we've spoken about this an awful lot throughout the module and the lectures and the session. So it's down to you to try and pull things together. Okay, this is where we're getting you to embed your work with academic literature as well. So there's going to be some information here that you might not find relevant, okay, but there's absolutely some. So especially things around the economic activity. So 53.3% of the population of this ward are economically active, okay, and those that are inactive, might mean that they are not in paid work or employment. Okay, so what does that then mean for them in terms of their disposable income that they have to spend on sport, physical activity? Okay, so lots of different statistics here. It gives you links to the top 3 industries and occupation that these people work in. Okay, so as you can see, top 3 industries are public administration, education, and health. All right, so that might give you a little bit of a sense as to what the roles are that the people from this ward profile have for their jobs. Quite a lot here in terms of services in Burngreave, so you might want to be thinking about how you can link any of this information to your assessment. So who might you be wanting to work in partnership with? So relate this back to the marketing mix, which we're going to talk about next week in terms of the session content and going into the 7 Ps in a little bit more detail. Okay, but for example, in terms of these services, some of these might link to the P of people. All right, so who might you want to be in partnership with? So would you want to work in partnership with a GP practice? Okay, and why? So often a lot of sport and physical activity, they do work in partnership with GPs because they are GP referrals. They might refer their patients to go and undertake some sport, physical activity. That because of physical or mental well-being. So you would want to work in partnership probably with the GPs, with the reception staff. You might want to promote any activities here in the GP surgeries or anywhere else within these services that are on offer within the area. There's a lot of other additional care and support services, so multi-agency support teams, so they're abbreviated to MAST. So think about everybody that works with children and young people. But again, you need to be specific with who you're working, who your target group is going to be. There's a lot around figures to do with childhood obesity. So again, if you're working with children and young people, some of this might be really relevant to you, okay? And that this is you providing a rationale as to why Kim and myself should select you and your programme of work to develop within the city. Interesting information in terms of life expectancy. So women are actually expected to live longer than the men by nearly 3 years. Okay, it talks to you about the death rate of under 75s. It's lots to do with cigarettes. Here we go, really useful information here about 52.7% of the population of Burngreave do not exercise, okay? Do not forget this module is all about how you are trying to get the least active people active, all right? So the drinking of alcohol, how healthy do the healthy foods that they eat, okay? And then it talks to you about what the death rate of people per 100,000 die from, so smoking, alcohol, etc. It then talks to you about the levels of deprivation and poverty that this ward faces. So it's the second most deprived ward in Sheffield out of the 28 that are on the slide before that we went through. So really deprived, and think about what that might mean. So facilities, transport links, jobs, income, etc. There's a lot there that you need to consider. So this is where it tells you about the average income household, so just over £20,000, okay? But it also tells you about the number of 2-year-olds who are eligible for things like free early learning and what that means. So the number of children receiving free school meals is at 28.1%. So again, how does that link to obesity levels, inactivity levels with regards to sport, physical activity? Okay, so some household income bands of working age households brings it down onto education. So if you look at the attendance of primary schools and secondary schools, okay, and how that has risen slightly to 97.4% from 97% as well. So you might want to carry out some research to see what primary secondary schools there are within the area as well. And then it gives you the comparison of the area to what is happening in Sheffield. So in terms of the percentage of pupils reaching the expected standard reading age, okay, for Key Stage 1 in Sheffield it's 71.4%. In Burngreave it's a lot lower at 55.2%. So it's giving you some information there. So you might need to be thinking about that and the standard reading with regards to any of the promotional materials that you come up with for that target group. There's some generic information, not generic, but information here with regards to community safety. So there might be, again, some information within this that is useful. So just an example here, the crime statistics. So if you look into them, antisocial behaviour. So have a think what that means. So antisocial behaviour could be young people hanging out on street corners, just, that could be noise, that could be violence, whatever that is. So can you think of any programmes or initiatives that might help to negate the antisocial behaviour? So some of the programmes of work that I used to work on involved the police and the fire service and was very much focused around antisocial behaviour at certain points of the year. So a big one would be around bonfire night and mischief night, as it's known locally in some of the areas, especially on the Friday before bonfire night. There'd be a lot of antisocial behaviour in terms of using fireworks, causing disruption, intolerable behaviour, etc. So we worked with the police and fire services to try and engage young people into safe environments and to move them away from where they will take part in that antisocial behaviour as well. Okay, so lots there, and again, look at where they're directing you in terms of some of the sources. So here we go, they're directing you to the Police UK. So this is where, when you're reading anything or looking into it, you need to be able to go and see where else you can find your information from. Okay, so that's the just a screencast on ward profiles of Sheffield. If we were going to go and have a look at another area just in comparison, so those of you who are familiar or unfamiliar with Sheffield, just to give you another example of an area that's more affluent and financially, that is Dore and Totley ward profile. So if you go into this profile, you can see it's on the southwest of the city there. So borders the Peak District, quite an affluent area of Sheffield. And again, gives you very similar information. So it tells you the neighbourhoods within the area and what they're known as. But it will tell you a little bit more about, so the same information on the gender, on the age. So as you can see here, there's a high population, 75 plus, compared to maybe the Burngreave ward. Religion, Christianity is a higher percentage than Islam compared to maybe Burngreave. Ethnicity, so a much lower BME population as well. So you can see some of the differences within the ward profiles as well. A lot more people are living alone here. Let's just have a look at the so I'm talking out loud now. The income, is that down here? Yeah, so the income here compared to Burngreave, which was just over £20,000 per household, is £45,000 per household. So, and it's the 26th most deprived ward out of Sheffield. So a big difference here in terms of some of the statistics and findings that you will see as well. So the key reading, and this is where you'll notice a big difference, that the reading is above the Sheffield average in an area like this. If you look at the antisocial behaviour, a much lower percentage. So there's lots there that you can think about utilising and comparing, and again, you providing a rationale for your assessment as well. So it's up to you. It's down to you to find the area. As I said to you in teaching, Kim and myself know the areas of Sheffield very well. We've worked there. We are still involved in some of the areas in terms of the volunteering work that we do and the playing. So we know this. It's down to you to find a specific area to base your campaign in. All right. So play around with it. Undertake your research. Get to know the areas. Okay. Thank you.